Good morning. Good morning. Isn't it nice to be in person? For those that are here, I know we've got several that are virtual, and we welcome you as well. My name is Dr. RonSonLyn Clark, and I am the president of the Kentucky Council on Problem Gambling. And we welcome you, those that are not from Owensboro, to our beautiful riverfront, and hope you enjoy today. Hopefully you can get out and take a little bit of a walk and enjoy the scenery. It's supposed to be nice today, and maybe around the low 50s. So I want to get started this morning talking a little bit about the history of our council. This is our 25th annual conference, and I think I have been to over 20 of them. And I remember the one year that I didn't go because it snowed here in Owensboro, and it was difficult for me to get to Lexington. And I felt just totally lost that year not being at the conference and seeing those folks that are like-minded and want to work with those who have disordered gambling. It's my honor to be the leader of this dedicated group of fine individuals from Kentucky who have made it a priority to bring awareness of disordered gambling to the forefront and educate our fellow Kentuckians about the myriad of issues surrounding the topic of disordered gambling. At this time, I'd like to recognize any of our board members who are present, if you could stand. We have more than this, but this is who is involved in here today. And you will see more at lunch. And if we have any of our certified gamblers in Kentucky, if you could also stand. Thank you. The Kentucky Council on Problem Gambling is a nonprofit 501c3 charitable organization. It was founded in 1995 and incorporated in 1996. It began as the vision of our own Dr. Curtis Barrett, who is sitting up front. He is Professor Emeritus with the University of Louisville. He saw in his teaching and practice that addicted gambling, then known as compulsive or pathological gambling, if you notice, I use the term disordered gambling, which it now has evolved to. He noticed that this existed in Kentucky. Action was needed to raise awareness of the issue among the citizenry, with governments, and even inside the gambling industry. Gambling industry is a friend of our council. We have representatives here today from different industry across southern Indiana and Kentucky. With organizing donations from the Kentucky Lottery Corporation in Churchill Downs, KYCPG began to organize training conferences and develop awareness materials. The principles that guided the selection of the first KYCPG board remain in place today. It represents the community and those impacted by problem and addicted gambling. Behavioral health counselors, academics, researchers, business people, government, clergy, and gambling industry, as well as recovering addicted gamblers. Board members pledge to follow the neutrality principle to neither advocate for nor oppose legal gambling. It was and is an active board, with members taking on roles and responsibilities to further the council's vision and mission. The American Psychiatric Association recognized gambling addiction as a pathological disorder in 1980. In the 2013 revision of the DSM-5, it was added as pathological gambling and renamed to disordered gambling, and reclassified at that time from impulse control into the section on addictive disorders. In 2001, KYCPG adopted its current name and followed in 2002 by developing a vision, a mission, and a series of strategic goals. These goals were last updated in 2021. The vision is to be the focal point for problem gambling issues in the Commonwealth of Kentucky. The mission is to increase awareness for problem gambling, promote prevention and research, and advocate for the availability of treatment. Sadly, Kentucky does not have a publicly funded problem and addicted gambler education, prevention, or treatment program. This exists in about 40 other jurisdictions and states that have legalized gambling, including all of the border states around Kentucky. The Kentucky Council is the source of awareness for services for problem gambling until legislation establishes a program in Kentucky. We are hoping that this year is our year with the passage of with the anticipated passage of the sports gambling bill. Attached to that bill is wording that would give us some funding for our council. What I want to tell you about are some of the highlights of the 25 years that we have been in existence and what we have done to fulfill our mission. The strategic plan for the council includes continued legislative efforts on the development of prevention and treatment programming to be funded by the state. It has been a priority of the council since its creation. Our council to date has not received any public funding to address the issues surrounding disordered gambling, and those who live with its consequences. As a board, we continue to seek funding which will enable us to provide enhanced efforts in prevention, treatment, and advocacy. We urgently need the support of public officials to help with this problem from a societal point and from a financial point. Of utmost concern to our council is the development of a disordered gambling based on two aspects: availability and accessibility. Gambling has been an activity since man lived in caves. Gambling has also evolved throughout history, from the days of shooting craps by rolling sheep ankle bones, to modern day casinos, and to more recently, to gambling via the internet. From the comfort of your home in pajamas at any time of the day or night. Spreading at a rapid pace are sports gambling, internet gambling sites, expansion of historical horse racing in Kentucky, and the emergence of addiction to video gaming. What has not been expanding at the same pace is the certification of gambling counselors in Kentucky. Herein lies another goal of the council: training and certification of gambling counselors. Originally in 1999, the first gambling training program yielded 13 certified counselors around the state. Since that time, we have lost some of these professionals. And sadly, although proudly, I say we have 7 certified gambler counselors in the state. That is to cover an entire state. Well, speaking with someone just yesterday, I'm one of those certified gamblers. Once you leave Louisville, and if you go straight down I-65 to Bowling Green and all points west, there's 2 of us to cover the whole western side of the state. And one of those doesn't see like private practice or practice that would include adults with gambling problems. We have an estimated number on the low end in the state of Kentucky of at least 150,000 individuals who would have a gambling problem. We urgently need to increase this number again. And our goal for the council is to have a certified gambling counselor in each of the community mental health centers in the state. That would be at least 14, so we need to double our number. We believe this is an attainable goal, and we strive each year to bring state-of-the-art, evidence-based best practices to educate those seeking certification. The council also seeks your advocacy help and that of elected officials to create parity so that commercial insurances will pay for the treatment of disordered gambling. The following are highlights of different projects in which the Kentucky Council on Problem Gambling has invested in effort over the last 25 years. From the onset, it was important to provide a public service for those seeking help and more information on problem gambling. With essential assistance from the Council on Compulsive Gambling in New Jersey and RiverValley Behavioral Health in Owensboro, the 1-800-GAMBLER hotline was established to provide crisis intervention and referral to treatment and assistance. Text and chat services were added in 2016. We have here represented today 2 of our individuals who have worked with that line, and I'm proud to say, since this is my organization, that they will be receiving an award today at our banquet. This is a great deal of effort has gone into establishing the crisis line, and we're very, very proud to say that it is here with us. At the start, KYCPG initiated annual education and awareness conferences, which are sitting in the 25th. These conferences were to inform behavioral health professionals of screening and counseling protocols to help problem gamblers and their families, encourage behavioral health professionals to achieve certification status, explore problem and addicted gambling issues, and understand the complexities of the gambling experience. Early awareness outreach produced It's a Great Game, a 20-page booklet explaining problem and addicted gambling, written by professional advisor to our council, Dr. Curtis Barrett. We have available on the display in the back on the left several of our brochures and pamphlets that we have produced over the years. In 1997, the first public awareness outreach promoted the highway billboard message that read, "Gambling can be addicted," and contained the 1-800-GAMBLER hotline. Many efforts continued over the next years, including in 2002, we organized the first public forum to explore gambling in Kentucky. It was held at the University of Louisville and was made available for public information. We provided a first test prep workshop to prepare counselors for the exam required to achieve certification. 24 individuals took that test prep and 23 passed the exam. We also became involved with Responsible Education Week, which at that time was the first week in August. We promoted responsible gaming practices through media campaigns and statewide distribution of posters and rack cards annually through 2017. I had been from one end of this state to the other, back and forth, doing these presentations to promote responsible gaming education. In 2003, the KYCPG was the host of the National Conference on Problem Gambling in Louisville. State Representative C.B. Embry introduced and achieved passage of the only problem gambling legislation adopted by the Kentucky General Assembly. This resolution led to a LRC report number 316, Compulsive Gambling in Kentucky, which documented 20,000 addicted gamblers in the state and suggested the need for more availability of treatment options for problem and addicted gamblers and their families. And that was in 2003. By 2007, we partnered with Prevention. We have Prevention representatives here with us as they released the KIP survey for youth at risk of having gambling behaviors and other behaviors. This was the first time gambling questions were added. KYCPG organized a media event in the Capitol Rotunda to point out lifetime rates of gambling by high school seniors was almost 50%, and 2% of those responding to the KIP survey indicated their gambling was causing problems at school or home. These numbers continue to increase each and every year. In 2009, Beat Addiction was updated and branded as Choices. There is always a right one. And this is through cooperation and work with our Kentucky Lottery. Research was a focus of KYCPG projects, and with the release of the Challenges for Kentucky, a report on the elements necessary for a comprehensive program to address problem in addicted gambling and problem gambling in Kentucky, an analysis of survey data collected in the fall of 2008 by the University of Kentucky Survey Research Center. The analysis of the landline telephone survey, be aware, landlines were going out of style then and they're pretty much a thing of the past now, indicated there are some 9,000 addicted gamblers, 51,000 problem gamblers, and 190,000 at risk for developing problem gambling in our state. Again, this was 2009, done by Landline. I'm going to fast forward a few years to 2016. KYCPG, with the support of the Kentucky Lottery at that point, added the text and chat services to the Gambler, 1-800-GAMBLER line, and we're so proud that that happened. I'm going to challenge anyone to say our helpline is probably one of the top ones in the whole country. Maybe I'm a little bit prejudiced, but I know those folks that work there. In 2018, working with the Kentucky Lottery, the Choices, There's Always a Right One addiction awareness curriculum was converted to an all-digital format. This is presented in schools across the Commonwealth. We would like to see it presented in more schools because it's really, really very well done. In 2019, KYCPG met with legislators to advocate for inclusion of problem gambling in sports gambling legislation and developed an advocacy briefing book to explain the public health need for the program. KYCPG affirmed its partnership with the Kentucky Lottery on PGAM activities. To cover a little bit of our last 5 years since we did a historical review. In 2020, KYCPG was saddened by the death of longtime President Herbert Bud Newman, who had guided the council's actions for 15 years. Our treasurer, Mike Townsend, who many of you know, came in and stepped in as an interim president to take over those duties that Bud was doing. In 2021, our annual conference focused on electronic gaming. The not really so new, but kind of new to some of us older people, way to look at gambling is through gaming. This broadened the council's awareness messages to emphasize the related addictive behavior associated with electronic gaming, particularly amongst our vulnerable youth. We added at that time Jeremy Kiefer, who is in our audience today, who is our resident gaming expert. You have any questions about gaming, go to Jeremy. I was elected president to fill some big shoes. It's still overwhelming at times to think about this. When I was getting ready this morning, and my husband's getting ready to leave for school, he came over to give me the perfunctory kiss goodbye. And he said, "So how does it feel to be president and being over this today?" And I said, "I really hadn't thought about it till you told me that. Now you made me nervous." KYCPG in 2021 created a scholarship program to fund counselor participation in a 30-hour training required for certified gambling counselor status. We have had several go through this training program. It is co-sponsored with Indiana, who is a great partner to us with our education efforts. And we have some that are continuing to go through this 30-hour training. KYCPG was invited to join as a non-voting member of the National Association of Administrators of Disordered Gambling Services. The Kentucky General Assembly passed legislation in 2021 amending the definition of parimutuel wagering to legalize historical horse racing betting machines, or HHR. Those of you in here from Owensboro will have been hearing and continue to hear a lot about one portion of our almost derelict mall becoming a site for Ellis Park to open up a historical horse racing. The change with that legislation resulted in an increase in HHR gambling venues to as many as 15 new sites, which is the one we're going to have here, by 2024. National sports betting online gambling company DraftKings agreed to fund Kentucky's responsible gaming awareness activities. A national survey reported that 78% of adult Kentuckians gamble. Due to COVID-19 pandemic, last year our conference had to be held virtually. That's why we're so glad to see people in person today. In 2022, today, is the kickoff of our 25th annual conference by both virtual and hybrid in person. We will be focusing our conference today and tomorrow on the impact of expanded gambling in communities in the state. In collaboration with the Department of Behavioral Health and Intellectual Disabilities, Kentucky Council has sought an agility grant through the NCPG to expand prevention activities and initiatives in the state. We're going to be looking at a site connected with the, not Owensboro, but connected with the expansion of the HHR and how this is targeting some individuals who are very vulnerable. The council updated its outreach exhibit and participated in the Kentucky Chamber of Commerce, Kentucky Society of Human Resource Management Health and Welfare Conference. We participated in the Missouri Lotteries Task Force to update the choices material and addiction awareness curriculum. We continue to promote our advocacy for a publicly funded problem and addiction gambling education, prevention, and treatment program. As time goes on, we may reach out to you to contact your legislators to assist us in that effort. I rarely take the podium that I don't say the next few things because it's so critical. As a certified gambling counselor, I try hard to never miss an opportunity to mention the statistics around gambling and suicide. It is estimated that about 20% of disordered gamblers will attempt suicide at some point as their disease progresses. This is a shocking statistic, and one that for most of us that are in the business of caring for others, we cannot ignore. Treatment, coupled with a self-help support group, is the best course of recovery for those individuals. We are very blessed this year to have my friend, virtual until 30 minutes ago, Jody Bechtold, who's going to talk about treatment, and we're going to have her books here. You've been asking for a treatment professional that can talk about treatment, and we were able to get Jody this year. For many years, our council has enjoyed a close relationship with Gamblers Anonymous, and we would like to take this time to recognize the importance of the role of GA in the recovery of the disordered gambler. Without this fellowship, many would be lost to us. Our council would also like to acknowledge the many contributions by the gambling industry across our state. Racetracks, the lottery, all different venues. Thank you for your support. It is very much appreciated. As I close and before I introduce our next speaker, again, I want to thank you for being here, being a part of this movement. We're a small but mighty force. We hope and we pray that this year the legislature sees us and will agree to the funding as we've proposed so that we can continue this valiant and mighty efforts to help those across Kentucky who live with the disease of disordered gambling. Thank you.